Hello and welcome back, students. So in previous class we discussed about the introduction of physiology of digestive tract. So in this class we are going to discuss about the salivary secretions, which include saliva, composition of saliva, function of saliva, and regulation of saliva. And the last we have to discuss about mastication in brief. So let's begin. So in the introductory part, we have to discuss in the coming slides, we have to discuss about introduction, classification of salivary glands, composition of saliva, and the properties of saliva, anatomy of salivary gland structures, function of saliva, and the last production of saliva and anatomical control on it. The last we have to discuss about the mastication in brief. Let's discuss the introductory. There are the three pair of major salivary gland and the numerous minor salivary gland. So when we talking about the salivary gland, we discuss about the major part. We have three pair of salivary gland and the other small numerous minor salivary glands. So their salivary secretions range about 800 ml to 1.5 liter, which required the 2.4 liter swallows per day. So the oral environment to large degree is regulated by the saliva. So oral environment means the pH and the liquidification and the voice. So all these things and the oral health is primarily responsible of the secretion of saliva. And we have to discuss in this slides, we have to discuss about the classification of salivary gland. So we classified the salivary glands into the various ways on the basis of anatomical location, on the basis of size, and not on the basis of type of secretion. So let's discuss about the first one, on the basis of anatomical locations. So on the basis of anatomical locations, we divide salivary gland into the four part. First is parotid gland, submandibular gland, sublingual gland, and the last is accessory gland. And discuss about the based on the size of the amount of secretion. So they are the major salivary gland, minor salivary gland, and the type of the secretions: the serous glands, mucus gland, the mixed parotid gland, purely serous, and the purely serous palatine glands, the purely mucus gland, the posterior part of the tongue, and the purely mucous submandibular glands, the predominantly serous and the mixed submandibular gland, predominantly mucous, mixed, labial, buccal, lingual, or the mixed. So these are the classifications. So on the basis of secretions, on the basis of size, on the basis of anatomical locations. So let's discuss about the composition of saliva. The parameter and the characteristics. On the basis of parameters, what are these? The volume, electrolyte, secretory protein, immunoglobulin, small organic, and the other components. So let's discuss about the volume. So as we discussed in the previous slides, the volume is 600 ml to 1000 ml, or we can say the 1 liter per day secrete saliva every day. So electrolytes, they secrete sodium, potassium, calcium, and your magnesium along with your iron. So then come to the protein parts and peptides. To secrete the amylase, the proline rich proteins, mucin, histine, and the cystatin, and the peroxides, lysosomes, and the lactoferrins. And the immunoglobulins, we talk about the immunoglobulin A, immunoglobulin G, and the immunoglobulin N. And the small organics like glucose, amino acid, urea, uric acid, lipid molecules. And the last, the components are the epidermal growth factor, insulin, this is a very rare amount, and the cyclic adenosine monophosphate B, and the proteins and the serum albumin. So these are the other components that are present in the saliva. And the saliva is made up of approximate 90% of the water, organic component, protein, the 2000 mg to 100 ml, enzymes, immunoglobulin, mucin, traces of albumin, and the polypeptides and the glycopeptides. Amylase 60 to 120 mg per 100 ml of protoids, and the 25 mg in 100 ml of submandibular glands, immunoglobulin A, immunoglobulin G, and immunoglobulin M, we discussed in the previous slides. And then come to the inorganic part, the sodium, potassium, chloride, bicarbonate, calcium, phosphorus, and the fluoride, and the antibacterial substance like lysosome, lactoferrin, sialoxide, and the glycoproteins, and the purine rich glycoprotein seen in the parotid saliva. Other components, what are the stearin, sialin, free amino acid, urea, and the glucose. So these are the components present in the saliva. Then come to the properties of the saliva. So consistency, the slightly cloudy due to the presence of mucin and the other cells. Saliva has the pH normal range 6.2 to the 7.6 with 6.7 being an average pH. So resting pH of the mouth does not fall below 6.3 on standing or the boiling. So it loses CO2 and become alkaline. So spatial gravity is 1.0024 to 1.0061. The freezing point of saliva is 0.067 to the 0.034 degrees Celsius, and the osmotic pressure is 700 to 1000 ml osmol per liter. Then come to the function of saliva. The first function is the chemical digestion. What is it? The breakdown of the starch into the salivary amylase is called the saliva. Is the function of salivary amylase, and the helping chewing and the swallowing. And the lubricating function is moisturize the inside of the mouth and create the smoother speech. Solvent effect, the solvent dissolve food and allow the tongue to taste food. And the cleaning effect of the saliva is wash away the food debris and the bacteria remaining in the mouth. And the antibacterial effect by lysozymes, peroxide, lactoferrin fight against the phagocytic microorganism, and pH buffering effect to prevent sudden change in our oral pH, and the supply minerals including calcium, phosphorus, magnesium. And then come to the production of saliva. The saliva is produced by a salivary gland of the body of the parotid, submandibular, and the sublingual gland. These are the major glands of our saliva. Within the gland we have acinar cells are responsible for the volume of the saliva secreted, and the ductus cells which are responsible for composition of saliva. So the volume is secreted by a acinar cell of the salivary gland, and the ductus cells secrete the composition of saliva, means the content of the saliva. And then come to the anatomical control of the secretion of saliva, autonomic control. The saliva is produced and secreted by the salivary gland of the body. So these glands are under control of autonomic nervous system comprised of sympathetic and parasympathetic nerve fibers. So the sympathetic control we discuss first. The sympathetic control of salivary production is via superior cervical ganglion. Sympathetic stimulation result in the release of noradrenaline, which act on alpha and the beta adrenergic receptors. So what they do? So this result in the following effect. So decrease production of the saliva by acinar cell, which is responsible for the volume of the saliva, and the decrease blood flow to the glands. And so there is a variable sympathetic innervation between the salivary ducts, or we can say salivary glands. On the whole, this system is far less important than the parasympathetic innervation in terms to the regulation of production of saliva. So or we can say the parasympathetic part of the nervous system is controls saliva more than compared to the sympathetic. The parasympathetic outflow is a coordination via the contrast of the medulla, and the innervation occur via facial and the glossopharyngeal nerve. Afferent, the information from the mouth, tongue, nose, the coordinated reflexes are integrated within the brain. So we got the reflexes from mouth, tongue, nose, and coordinated into your brain. And the presence of the food, parasympathetic stimulation occurred. What they do, the parasympathetic outflow result in the release of ACH, so acetylcholine, into the The muscarine receptors, what they do, though this result is the following effects. When we got the release of ACH in the M3, so happens something in our parasympathetic nervous system. What they do, the acinar cell increase the secretion of saliva, ducted cell increase the HCO2 secretions, and the transmitters result in the increased blood flow to the salivary glands. The concentration of the myoepithelium is increased, the rate of the explosion of the saliva. Overall, the increased parasympathetic stimulation result in the increase of outflow of saliva, that is the more watery in composition. So you see how the parasympathetic nervous system control the secretion of saliva. And in the last we have to discover the mechanical mastication mechanism in brief. That during the mastication or the act of the chewing, food is broke down with a small fragment and mixing with saliva. The food particles are thereby lubricated and the softened and exposed to the digestive enzyme process, which are the essential for the formation of the food bolus suitable for the swallowing. Bolus is ultimately go for the next process of the digestion, which is called swallowing. The mastication, which required the involvement of the tooth, the masticatory muscles, which is the strongest muscle of the body, and the temporomandibular joint, TMJ joint, and the tongue facilitate the subsequent gastrointestinal absorption of food particles. The mastication is under the control of the central pattern generator located in the brainstem, which is regulated by the extensive sensory inputs involved from your oral cavity during the ingestion and the chewing of the food. In order to constantly adjust the act of the chewing to the food particle textures are facilitated formation of your bolus ready for the swallowing. So this is all about your saliva. These are the references, and thank you so much guys. If you have any question, let us know and ping me and drop me a message, or you can directly mail it to me. Thank you so much.